Hey there HHD students, my name's Andy, I'm a VCE Health and Human Development teacher. In this short video we're going to look at health promotion in relation to smoking, road safety and skin cancer in VCE HHD. Before we dive into this video, just a reminder there's a range of different ways you can engage with the Health Resources Hub. We've got our YouTube channel where there's over 150 content videos, SAC and exam tips, and new videos are coming out each week during the school term this year. If you're on YouTube, you can subscribe with the button in the bottom corner of the video there, or you can just head to YouTube and search for the Health Resources Hub. We've also got our website, the hrh.net.au, where there's opportunities for teachers and students. And if you're a Unit 3 and 4 student, you can head there and sign up to our free student newsletter, which is coming out twice a term. The latest version of that is coming out in the next few days, so if you sign up there you'll get sent that as well as previous versions, so please head to our website if you'd like to join up to our free student newsletter. We've also got our social media links there if you'd like to follow us and get alerts to our new videos and other opportunities, and also our email if you'd like to get in touch. So this video is focusing on health promotion in relation to smoking, road safety and skin cancer. And so this is the key knowledge point, okay, that is part of the study design for this particular topic. And you'll see that this is the one part in Unit 3 and 4 where there's some choice in relation to what different students and I guess schools focus on. So in your class, you'll be focusing either on smoking, road safety, or skin cancer. So you don't need to cover all three of those for your SAC or the exam at the end of the year. You just need to have a focus on one. And for whichever is chosen by you and your school, okay, you need to know why it was or is targeted as an area for health promotion, the effectiveness of health promotion in improving population health in that area, and how health promotion reflects the action areas of the Ottawa Charter for Health Promotion in that particular area. So we're going to have a look at those now. So in relation to why these areas are targeted for health promotion, it's pretty similar across all of these three particular focus areas, why they were, I guess, a choice for health promotion. And it's worth noting that these are areas in Australia over the last 50 or so years where there has been significant improvements in relation to health and wellbeing and health status. So that was one of the reasons why they were chosen to be included in the course, because it's an area that teachers and students can focus on and look at, well, what has worked in relation to health promotion to a certain extent in Australia. So you can see here there is some sort of generic reasons that could be applied to all three of these particular target areas in relation to why they were chosen for health promotion. So you can see there, I've got underneath that question, the first key knowledge point, or the first dot point there, ... So that's where you could insert, for example, sun, okay, exposure is a modifiable behavior, and therefore many of the costs associated with skin cancer can be prevented. Or you could say something like road behavior is a modifiable behavior, therefore many of the costs associated, okay, with road injuries can be prevented. So whatever your particular focus is, you can insert it into those sort of gaps there. That's the same with the second and the third one. So you could say that skin cancer contributes significantly to Australia's mortality and morbidity each year, or smoking and the associated conditions like lung cancer contribute significantly to Australia's mortality and morbidity each year. So once again, you can insert whatever your condition is that you've chosen at your school. And then the third one there, so you could say that road safety and road injuries leads to significant social and economic costs in Australia every year. Okay, so all of those three there at the top, okay, can be essentially adjusted depending on what your particular focus is at your school. Then you can see down the bottom I've got three additional points there, and they are essentially the same point but just slightly adjusted, because for all of these particular target areas there are particular groups, okay, population groups within Australia that are, okay, disproportionately affected by them. And so you can see there, for example, skin cancer rates are higher in disadvantaged groups such as those living outside major cities, and that can result in significant health gains in these groups if sun exposure levels are reduced. So you can see for smoking rates, it's those living outside major cities, lower SES groups and Indigenous populations. But it's essentially saying for each of those three target areas the same thing, that there's disadvantaged groups that are disproportionately affected. So if there are gains, okay, made in those groups, then that can be significant for the health status and health and well-being of those population groups. So all of those things there are examples of why these particular areas were targeted for health promotion. Now, another part of this key knowledge point is knowing how health promotion in relation to it reflects the action areas of the Ottawa Charter. So I'd know a couple of things, okay, in relation to this. So I'd make sure that you know at least one program, ideally two programs, I think, that cover a range of the Ottawa Charter action areas. And so, for example, you might be learning about the QUIT program as part of smoking, or you might be learning about the Driver Reviver program as part of road safety. So whatever program or a couple of programs that you learn, I'd try to make sure that within what you've learned about that program, you can link it to, okay, at least 2 or 3, okay, action areas of the Ottawa Charter per program. And ideally, across the 2 programs that you'd learnt, you would cover all 5 of the action areas of the Ottawa Charter. And that's just in case on your SAC or on the exam, there's a question that asks you to outline how a particular program or initiative, okay, in relation to your target area reflects an action area of the Ottawa Charter. You'll have, okay, some examples ready to go. The second point I've got there is that I would think it's also worth knowing some other examples of health promotion initiatives or activities in your particular area that aren't necessarily part of a program. So, for example, you would know in relation to road safety that there's obviously speed limits that have been introduced, say, in school zones. That's not really a program, but it's still like an initiative or an activity that you can link to an action area of the Ottawa Charter for road safety. So on top of a couple of programs, I would just know a few other examples of initiatives or activities in relation to your particular target area that you can also link to an action area of the Ottawa Charter. And that's in case a question comes up where it's not necessarily asking you to describe a program, but it's just asking you to give an example of like an initiative or an activity that you could link to an action area of the Ottawa Charter. And then finally, you might be asked to determine if a health promotion program is likely to be effective, okay, in relation to your particular target area. And so this question came up on the exam a few years ago, and there was a range of different ways that students could evaluate whether or not a program was likely to be effective. And so I've listed those there. So the first point there is actual improvements. So if you know some information about a particular program and how it has, okay, been effective, you know that this is the change that's happened after it was implemented, or this is how many people were helped, then that's good. You're not expected, okay, to memorize that information. So the second point there is potential improvements. So you could talk about if people took part in this program, this is what may happen and how it might improve their health and well-being or their health status. The third one is features of effective aid programs, okay, and so I say aid programs because this is really related to Unit 4, which you won't have covered yet, but these are features of effective aid programs that you could apply to just any, I guess, program, including those in Unit 3, so results focus, partnerships, collaboration, ownership, appropriateness, etc. So we'll cover those more when we get to Unit 4, but you could have used that, okay, in the exam a few years ago when there was this question, or you could have used the action areas of the Ottawa Charter or the principles of the social model of health to determine if a program demonstrated those, and therefore if it did, okay, it was likely to be an effective program. So I would just note those things down in your notes. If a question came up and you are asked whether or not a program was likely to be effective in one of these particular areas, then this is a way that you could sort of make that evaluation. Okay, hopefully you found this video useful. Just a reminder, on April 28th, we have one more of these Unit 3 Area Study 2 SAC preparation sessions and common mistakes advice sessions coming up. So you can head to our website there, hrh.net.au, or to that link down the bottom there to register, and you'll get sent a 50-mark practice SAC, okay, to complete prior to this online session, and then I'll run through the answers and the answer guide, including how you can structure your responses to achieve full marks, and you'll get sent also a copy of the answer guide to help you prepare for your SAC in this area. So if you're interested, please head there and sign up. Thanks so much.